Hey, everybody, welcome to another Sunday morning conversation. Today, my guest is Dr. Miguel Escalon. He is the vice chair and director of the ICU Rehab and PMR residency at Mount Sinai Rehab. And he's board certified in TBI and SCI. So today, we're going to have a nice little conversation, about a half an hour long, and I hope you enjoy. Thank you. How are you, Doc?
All right, how are you?
Uh, Not bad. It's a rainy day down here.
Yeah, I don't even know what the weather is outside right now.
Have you been on call or something?
No, just here since early.
Okay. So, Doc, how have things been going up in New York?
They're going okay. They feel pretty normal, besides people wearing masks still, but things are good.
I read a lot. I was looking you up on Google Scholar the other day, and I read that you had written a lot of, well, at least some COVID research papers on there.
Yeah, a few. A lot of them are more about like the response on the hospital side, like how we dealt with it, as opposed to like numbers of patients or different things like that.
Have any of them tied into like brain injuries? I didn't like get that far into depth into them.
No, not yet. At least not ones that I've done.
Okay, I did see you did a paper on TBIs with Black people in the recovery, and I assumed that, yeah, it was probably going to be, before I even read it, like socioeconomic status played a significant role in that. But I mean, could you tell me a little bit more about it?
Yeah, sure. So the paper was kind of generally speaking to disparities that Black people face in the rehab world. So strokes and traumatic brain injuries being like a subset. But basically, if we take the greater world of brain injuries, which would include stroke, you're less likely to, in some of these cases, you're less likely to even come to acute rehab, even accounting for socioeconomic status. So like if you're Black and you have insurance, then you're still less likely to come to acute rehab.
Well, doesn't that have a lot to do, I mean, with past experience with the Black community and, you know, modern medicine, like going back to the Tuskegee experiments? They are very fearful of doctors, and I guess that has to do with it too.
I can't speak to that because we were just reviewing other research that had been done and taking all those numbers and compiling them into one place. And these people weren't asked, why or why not, and if they had had the chance, would they have gone? The assumption that was made in those other articles that we were quoting from was that because they never had the chance, it's not fair. Now, how many of those people would have were like, I don't know how many of those people actually had no idea or chose not to come. I would like to think that rehab is different, but I can't speak. I have I certainly haven't been through something traumatic like a TBI, and I'm not Black, so I can't speak to their experience there.
Yeah, I'm only generalizing what I've known and what I've watched either on TV news articles or stuff like NPR, so I can only speak to that too. Um, so Doc, what made you want to get into like to TBIs and brain injuries and strokes? What motivated you to go into that?
Yeah, well, it's something I grew into, I guess. It's not something I went to medical school even knowing about or thinking about. But I guess when I think about it, if I take a moment to reflect, um, for me, rehab patients, and especially those with, say, a traumatic brain injury, get better in ways that matter to me and that matter to either that patient or their family. So I guess what I would say is, like, if I have high cholesterol and my doctor gives me a cholesterol pill, they're probably saving my life because I won't get a heart attack, but I don't feel that. And that doesn't change my day to day because something that could have happened hopefully never will. But it's different than, say, not moving one of your extremities or multiple after a traumatic brain injury, and then slowly seeing that come back, or having that pain and slowly seeing that go away. So at least for me, it just felt like I was helping in a way that, or that I am helping in a way that is tangible and that people feel.
The funny thing is, like, I don't know how to phrase this in a proper way because I do have trouble doing that sometimes. But for people with brain injuries, it's an invisible injury, whereas people can't, they have a hard time empathizing it because they can't see it. And whereas, like, if you have a heart attack and you give them a pill and everything, people can associate, oh, wow, you're not doing too well. And it's just one of those things where you just said it was kind of like the roles reversed, where it actually had an impact on us, but nobody really sees that other than us.
Yeah, well, you're right. You're speaking to how in many cases a traumatic brain injury can be considered an invisible disability, because physically you may be fine, but your processing may be different, or your vision may be different, or your emotional regulation may be different.
Yeah,
And
I
people
got
don't,
three for
people,
three, 3 for 3 right there.
people don't, uh, people quickly forget when you're talking to them or you develop a relationship. And I agree, it's abstract. I'll see if I can explain this in a different way. If I say you broke your knee, and I went to your family and everyone you care about, and I said, Eric is going to have a limp for the rest of his life, they would say, okay, we get it. He broke his knee. And now take the same thing with a traumatic brain injury. I say, hey, Eric may always be quick to anger. It doesn't compute like the same way.
I've used that same example. Like, so if you see somebody with a permanent limp for the rest of their life, you can empathize with that, but with a brain injury, you can't. And, like, for all intents and purposes, I look like a normal person. I sound like one. I talk and act like one, at least for the most part. When you get to know me, you start to see some of the cracks in it, to where you could, like, how my emotional regulation, where it's most of the time my response can be anger, and that's just because that's the only thing my brain can make sense of. It's like, we're just going to press the anger button, and that's our default response to it. And it's just how it deals with confusion. Confusion leads to anger.
Yeah. Yeah, it's very hard. And it's like people, I I don't know what more to add, because I think you said it well, and we've talked about it some just now, but it's not, and that's why they call it an invisible disability. Not only because you can't see it, in my mind, from like across the street, like I don't see you walking, but also because I'm blind to it as somebody that's not living it. I can go blind to why you're getting angry. Um, and I can react angrily in return, instead of understanding what you just said, which is your process. Like, your anger is a way to process.
Yeah, and I'm luckier in some aspects. I'm luckier than others, and some, and others not. But I don't have a lot of support locally here in Atlanta. But my mom, who lives, she lives in Ohio. She's a nurse, and she happened to get hurt on the job. She has RSD, if you're familiar with that. Yeah, she got hurt on the job, so she went through the disability process at a young age too. Obviously, she never wanted that for her child, but you know, having my mom being able to relate, at least to some extent, about a brain injury, and if she doesn't understand it, she just looks it up, and then it makes sense to her. Having someone like that, to me, has been very helpful. And unfortunately, there's a lot of people who don't have that. They have their caretaker, who's their spouse, their mom, and they're not related to the medical field, and things like that don't make sense. Where I do things that don't even make sense to me, but at least to her, she can rationale it with a medical perspective on it.
Yeah, that's an excellent point, and that's why a podcast like this kind of forum is important, because not everyone has access to the internet in the same ways, or knows where to look. And if you read something medical, like you said, you have to also understand it. So if you're able to find a website, like a medical website, that's explaining whatever's going on with the brain injury, the person reading it has to be able to understand that and apply it to their situation.
Yeah, and the hardest part for me, going through this for mostly by myself is going through all the doctor's appointments to where, you know, my mom would like kind of, she would hype me up a little bit, tell me like, okay, you need to ask this, this, and this. But the fact that she couldn't go there with me, and, you know, and I had the stuff that I wanted to ask, I wasn't able to actively ask a follow-up question because I was still busy processing everything that was going on. And I wouldn't have my follow-up question to maybe later in the day, tomorrow, you know, then it would hit me. Whereas most people would have that follow-up question right away because it just took so long to process everything that would happen in my neurologist appointment and stuff.
Right. Yeah. I mean, it's a good point in some ways.
You need an advocate of some sorts.
You need an advocate, or you need, you know, people need to understand kind of on all sides. So having an advocate, like you said, is super important. Having a doctor that understands that you might call back the next day because you have another question is important too. And there's different ways now to access doctors. You know, like there's these patient portals. I get messages all the time. I get them like little emails or texts, and I just write back. And so it's different. I think, at least from, say, the medical side, we can adapt in ways that we used to not. You know, if you had a question and I wasn't in the office before, and all I had was a landline, you weren't getting a hold of me. But now there are other ways, and so even if I don't respond right away or someone else doesn't, we could still kind of figure that out. But advocacy is important, and there are different kinds of advocacy, right? And you're specifically talking to someone that can help you navigate the everyday, and will be, you know, there by your side and understands what you're living and going through.
And, you know, the thing is, like, on Twitter, I'm connected to a lot of different people related to brain injuries, not just, you know, I searched out people like you or, you know, different PAs, neurologists, stuff like that, because I'm interested to what you're posting. But I've also found people, now they're not in the United States, but like in some in Canada and Europe, who are designated advocates for brain injury patients who will help them out through the process. And we don't have that in here. I feel like, you know, the United States is really losing out.
Yeah, no, I mean, that would be amazing if we had that here. We don't. We have social workers, we have case managers that sometimes will help you navigate it, but it's not the same. And it's so variable, and to find someone with experience is really hard. And the other thing is, like, the system, like state to state, the system, like the Medicaid system, and like nothing is standardized. So you have to be an expert. Like, you know, I'm not Canadian, let's say, but let's say there are these kinds of advocates in Canada. Well, they are working under like one system. So if I move from Toronto to Vancouver, it should be the same kind of, you know, minus a couple of things. But here, like, the difference between Georgia and New York in terms of what services there are, I'm sure is huge.
We don't have expanded Medicaid or Medicare or whichever one it is. So we, you know, I wasn't even eligible for 2 years until I was declared disabled. So it's, you know, if you go to my brother lives in Colorado or my parents live in Ohio, I could have got on it right away, which would have made a huge difference in my recovery too, you know?
Yeah.
See, the problem I had fighting with was, you know, obviously you being in the medical field, you know, it's a horrible idea to tie your insurance to employment, right? If I had tried to go back to work constantly, I tried 4 different times to go back to work as an architect. And each time, you know, nothing had changed. I wasn't able to do any rehab because when I lost, you know, when they would fire me because I couldn't do my job, I couldn't treat them because I was paying out of pocket. And then when I got a job, I was so bogged down because I couldn't process and work as fast that I was spending even more time at work. So I had no time to go treat. And thank you. I had no time to treat. And so it was, you know, it was like being stuck in a horrible cycle until we finally said, this isn't working, you know. But I'm sure a lot of people have that same thing. And the fact that, you know, we don't have a single payer system really hurts people like me.
Yeah, I agree. And the other thing that can be hard, talking about insurance companies, a lot of insurance companies after a traumatic brain injury don't consider the cognitive, emotional effects of the brain injury when you're talking about rehab. So they won't pay for, you know, if you're strong, like if I examine you and your muscle strength is normal, then they say, okay, you don't need rehab, let's say. Or if you're walking around you don't need OT because you're walking around fine. And they're not considering, what the brain injury is doing otherwise in terms of your ability to actually do all the tasks you need to live your life, even though you're physically strong. And I see that all the time where patients are walking around the acute inpatient rehab unit after a brain injury. They're walking around constantly, but you can see that they're not themselves. Things are different, the way they're processing, and the insurance stops paying because they're walking, 500 feet or whatever, and they have to go. And the system is broken in that way that people that have gone through what you've gone through aren't, you're seen in like little bits. You're not seen as a whole.
Yeah, and then I mean the actual mental health aspect of it too is far, also not taken into consideration hardly at all, because your brain, I always said, is like two things. I said there was one, it was like scrambled eggs. Two, is like when it's like having a snow globe shook, right? All the snow goes up in the air, and when it comes down to settle, it takes a long time, but it never settles in the same place. So you have a lot of psychotherapy to do with it too, and that's usually not covered. And if it is, they don't want to cover it. Like, I needed to go once a week, once every 2 weeks early on, because my shit was just not together, and they just did not want to cover it. I had Kaiser at the time through my job. They wanted to let me go like every 6 weeks. I'm like, that is not going to work for me. And that's all I could get. And I don't think they ever took consideration that when they went into it.
Yeah, you're right. Insurance is really hard to cover for psychotherapy, and for some people that might need psychiatrists, at least where I practice, they're hard to find. That wait list to get in to see a psychiatrist is really long.
Yes, indeed. It can be months. And I don't know how, like, I haven't had to find a new psychiatrist yet. It might be on my table, but I don't know how it works with, like, a lot of places are, not seeing patients still, like, at least for COVID, I couldn't look because they weren't taking in new patients because they didn't want to meet in person. My psychiatrist still does not meet in person. So I don't know how that actually works now, but, and it also feels like when I'm in the process of searching for psychiatrists that they don't have a good reputation. You look at all the health grades or whatever these websites are, and they all get dinged pretty hard. And I don't know if it's just because people don't like them or if they're really bad. You don't know, but I mean,
Yeah.
it's pretty common.
Yeah. I mean, I'd imagine that, like any kind of doctor, I'm sure they're a bad psychiatrist, an amazing psychiatrist, but I'm sure they're really busy.
Yeah.
And maybe that's part of it, because they have to get through so many patients in a day, and they're just, maybe they wish they could spend more time and they don't. But it'd be interesting to kind of talk to a psychiatrist that sees people with brain injury, ask them those kinds of things. And that's the other thing, is there aren't a lot of psychiatrists that, like, you could find one, but that doesn't necessarily mean they have experience with traumatic brain injury.
And then you got to remember that traumatic brain injury is usually not the only thing that you end up with. I did end up with PTSD because I got hit by a Tahoe, and it developed I developed depression. So it's a brain injury, and I had anxiety too. So brain injury does not just mean one thing. It usually accompanies a few things with it.
Yeah, no, you're right. It's I think the snow globe analogy was really good, and I think that fits what you're saying right now.
And so I mean, since you're on the rehab, I mean, you at Mount Sinai, you are director of rehab, correct? Right?
Yeah, for a brain injury.
Okay. So, what aspects do you deal with there in brain rehab, other than like the OT? You're probably doing the PT, right? For like stuff like balance, coordination. What else do you have going on there?
Yeah, so we have an inpatient rehab unit. So if someone suffers a traumatic brain injury, they can come to us. You stay the night, and so it's like you're admitted to the hospital. So we do have a team. So we have the physical therapy, occupational, speech. We have neuropsychology, and so we have all these folks that will see people while they're admitted. We also take all kinds of brain injuries. So anyone from what is sometimes referred to as disorders of consciousness, which used to be called like vegetative state. We don't really use that term anymore, but just in case anyone's not familiar with some of the more medical terms like unresponsive wakefulness and stuff. So we'll take someone with like super severe brain injury all the way to people that have quote unquote mild, even though it's not the best word to use.
No,
But
it's not.
so, and everything in between. So we'll do, some people need like botulinum toxin injections for spasticity, like that on the unit, or if they need different medications, or, we'll start, we can have them see a psychiatrist, whoever, while they're with us. People stay a few weeks or a month, or, give or take. And they hopefully are able to transition home after that.
Okay. Now, I mean, that mild is definitely the not a real. It's a relative term almost, because
Right.
mine was an MTBI. However, my symptoms persisted for longer than usual. That 3 to 6 months that they told me, my symptoms are still around, and they lingered for a long time. And the fact that I wasn't able to, the first 2 years, to do any meaningful rehab, psychotherapy, anything really, it definitely played a role in my recovery. But mild is really a relative term, and I feel like it definitely is the bad one to use to describe it.
Yeah, it's just the medical terminology is what it is.
Yeah.
That's why I couched it a little bit, because just because a doctor calls something mild doesn't mean it doesn't flip your life upside down. It just has to do with like whatever numbers or tests, but the mild doesn't actually speak to, like I said, how it affects your life. And I think that's a problem also, from maybe something to think about, which I've not thought before or said out loud before, but that's hard when you're dealing with an insurance company and the doctor's writing that you have a mild brain injury. It doesn't compute, because you're telling the insurance company you have all these issues, and the doctor's writing it that it's mild. So even though the doctor doesn't mean to do that, the insurance company can read it that way.
Well, it's even more complicated when you're involved in a lawsuit over it too, and the term
Yeah.
gets misconstrued over, the span of, mine was 3.5 years. So it becomes even more difficult at that point. And you have doctors that you're seeing, two sets of doctors. The defense is wanting you to see their doctors, who are going to say the exact opposite of everything who's treating you, whether that's, right or wrong or not. And so it becomes a battle, and it's really hard on me. And definitely, between dealing with the rehab stuff as it is, but it just adds on you, and it ages you in a lot. It's a lot of stress, anxiety that you go through every day. And it took 3.5 years for that part to settle. And it was definitely, in my attorneys, after that first 2 years, we decided, like, okay, being an architect is not going to work for you. Then we started paying out of pocket for the best doctors we could find. And then that's when I started making some of my progress. But, people who have to go through the lawsuit like me, it is definitely, it ages you. And there are other people who don't have to go through that. They don't have the benefit of that extra money coming in to help them pay for their, their needs. Like, I got a sizable sum of money for this, but it went through mostly treating my, my disabilities and all my medical treatment. But other people, they don't have that luxury. Sometimes they just go over the handlebars of a bicycle and they get an MTBI. There's nothing there from them, and they're paying all out of pocket. Or if it ends their career, and it's like, well, what am I supposed to do now? And if you're in a state like Georgia, where you can't get on Medicare or Medicaid right away, what are you supposed to do? Obamacare isn't exactly the most affordable due to the policy being stripped so much. And you're paying out the ass, essentially, to get your treatments, and it's almost not worth even having insurance.
Yeah, it's a system is broken. But luckily there, even though it can seem dark, at least if we're going to say at least anything, there is the internet, and you can track people down that can help. So I don't know how, you were able to find me on Twitter and stuff, but let's say, and I have patients that come from upstate New York and different places, it's several hours drive, say they find me online. I don't know what they would have done, 15, 20 years ago without the internet, how they would have found anybody.
Yeah, and well, not only that, 15, 20 years ago, you wouldn't have had like, I mean, medical technology has advanced a lot, at least, in all aspects, but with TBIs at that point too. I mean, they would have, there was a lot of unknowns that they wouldn't have known about themselves either, had they did, find you.
Yeah, that's fair too. Yeah, lots changing every year. A lot changes.
What is the weirdest cause of a TBI you've seen for a patient that's came to you?
Oh,
I had a
that's an
guy tell me, a block of like hundreds of pounds of cheese fell on him. So
oh,
yeah.
no, I haven't seen that. I've heard of uh, people falling from different places. I think a tree branch, I guess, isn't weird, but it always scares me because you're not looking for that. So tree branch falling out people's heads. I've had a couple patients that have been injured that way. I can't say anything too crazy. I had a patient once in residency who was just having fun, like being pulled in one of those inner tubes. And
Uh-huh.
that kind of like there was a sharp turn. And so the tube like slingshotted them into like a shed. That was not good.
Okay. So Doc, I'm going to get you out on here on this last question.
Okay.
What is a piece of advice that someone hasn't given me yet that you might know of?
Oh, you're closing with the two hard ones. All right. So uh, I think what I would say is the advice I give people when I meet them, say you were coming to me in the office and saying you're having a lot of problems with X, Y, or Z. One is doctors will tell you that the improvement happens in the first 6 months, year, whatever. I've seen people improve years out. We don't fully understand the brain. It wasn't that long ago where we thought you were born with a certain amount of brain cells and then they didn't regrow. And now we know that they can regenerate. So one is there's always hope to get better. And no doctor can promise you how far that's going to go, but there's always some hope to hold on to. And the other thing is, and this one sometimes is more for families, but a lot of people focus on the negative, like what I don't have or what is missing, what's missing from Eric now. But if you flip that and you say, how is Eric exactly the same as he was before, and what are things that are still the same, his sense of humor or what like love of sports or whatever, it helps a lot and it helps reframe. And I find that positivity, even though it's much easier for me to say it than do it, is really important in recovery and having that support that's a positive support.
Yeah, that's definitely, for the longest time, I definitely did think about the negative, what I used to be, what was taken from me. And now I try to, look at the glass half full if I can, like what was good to come out of the situation, how, or uh, to flip it, it's like, how can I turn a negative into a positive, even if it's a little one, right? You could take a big negative and turn it into a positive. Like I had a car accident with mine, and I figured out how I took something negative that had happened and I turned it into something positive, like with minor details and calling different offices in Mazda, yada yada yada. It's like, okay, I turned that into a positive. It was work, but it was a positive. And anything with a brain injury is going to be work. Nothing is ever going to come easy for me or for anyone else like me. It's always going to be a struggle. And the thing is, for the most part, outside of doctors and nurses and medical professionals, no one's really going to know what kind of struggle you're actually going through.
Yeah, that's all true. And even every brain injury is so different. So, I understand only in so much as what patients tell me, but nobody's ever gonna feel what you feel. And I think that's important too, to kind of understand that. And that, I guess I'm talking to myself and maybe other practitioners, right? I never say, I try to say, I try never to say, I understand how you're feeling. I say things like, I can only imagine, how hard this must be, or I can't imagine, what you must be going through. But I can try.
You can try it, and the thing is, you can have empathy, and sometimes empathy is what we really want.
Yeah.
We don't want you to really understand what we're going through, but you want to kind of like, you've seen enough of us that even though we're all different, you can get an idea of what it is like, and you can at least apply some generalization of that experience to us. It's like, I've seen people like you before, I understand that this is what you go through. And in a way, it's like, if you can even provide them with resources, like, these are some support groups you can talk to. These are people who are like you. They're not all going to be the same as you, but they're people who, have walked a mile in your shoes, at least in some way, and
Yeah.
having that has been helpful for me. Like, when I first started going to support groups, I had people there who were caretakers and survivors. So I had that, there were people there who were like me, doing this, process here. I met someone in South Africa who had basically walked a mile in my shoes, and we talked. She is, I don't know how many time zones away, but we talk on a regular basis. I didn't have that locally, so I had to go get that. I got that globally. So you can pull people that you need from anywhere, but there are people out there who have walked a mile in your shoes. It's just the medical professionals tend to, I guess, they've seen enough of these to where if they're not really new to it, they can, like, at least assimilate some kind of idea of what it is like, and at least tell you, give you some kind of guidance.
Yeah. No, and they should. And that, I guessed at some of the things that somebody with invisible disability from brain injury, might have earlier. And you're right. So the job of the doctor, as much as it is to empathize, it is to guide. I may not have a pill that's going to make everything better, but like you said, a doctor should be able to give you some resources or point you in the right direction.
Yeah. And the hardest part is, it's never going to be just one doctor. It wouldn't be just you. It's essentially a team, because there's you, and then there's probably a psychiatrist that you're going to need to see because of your emotional outbursts and everything, and you're going to have to see them. You have a whole team of people, and for the most part, they try to work in collaboration, but it's up to me to collaborate everybody and make sure, okay, this person knows this. You have to keep everybody informed in order to get the best care. And it is a lot to put on someone with a brain injury to handle all that, because you forget stuff. So
yeah. That's very right.
well, all right, Doc. Thank you for giving me your time today. I appreciate it.
Of course, this was fun. Thank you for inviting me.
Yeah. All right. Enjoy the rest of your week.
You too.